seem like the stuff of fiction, but a series of improbable and unfortunate events occasionally leads to the most bizarre objects gaining entry into the human body. Some of these events were traumatic accidents. Others were self-inflicted acts of idiocy. Some of the wounded were simply in the wrong place at the wrong time. Modern medicine has led to some incredible developments: antibiotics, MRI scanners, transplants, surgical robots. Without these achievements, many of the following patients would have either died or led severely debilitated lives. So spare a thought for the medical fraternity as we reveal the 10 strangest objects extracted from the human body. A swordfish bill. A young woman was enjoying a paddle off the coast of Santorini Island when all of a sudden she felt a stabbing sensation around her upper abdomen. Realizing she had been speared by an angry fish, the woman pulled the animal from her body and made a speedy retreat. X-ray, CT, and MRI scans revealed damage to the liver and distension of the surrounding blood vessels. Of greater concern was the bony tip of the swordfish bill found lodged in the woman's spinal canal. Surgeons controlled the bleeding and repaired the tissue damage. Additional surgery was then conducted to remove the swordfish bill. Over a month later, and following several courses of antibiotics, the woman left the hospital on the mend. The remains of a bill were found near the scene of the attack. Ichthyologists confirmed that the deadly weapon belonged to a swordfish. To this day, the perp remains on the run. According to a 2010 report penned in the journal BMC Surgery, there have been 4 cases of swordfish attacks discussed in scientific literature. One victim suffered thoracic trauma, another a knee injury, and 2 others sustained head traumas. One of the reported victims, a 39-year-old fisherman, eventually succumbed to his injuries. The man was fishing in his boat when he shined a torchlight into the waters below. In a murderous frenzy, the swordfish leapt towards its unsuspecting prey. Swordfish often hunt at night for small fish, surveying the water's surface for movement. Researchers believe the swordfish struck after mistaking a flashlight for a source of food. Pea plant. Back in 2010, Massachusetts resident was rushed to the hospital with a suspected collapsed lung. The 75-year-old retired teacher, Ron Sweden, presented with shortness of breath and a cough, symptoms that were initially attributed to emphysema. After the man's admission to A&E, doctors embarked on a frantic and confusing search for the cause of Sweden's collapsed lung. The clinical team's differential diagnosis ruled out cancer, but X-ray scans revealed the presence of an unusual growth. There, inside the patient's lung, was a tiny 1-centimeter pea plant. Months prior, Sweden was enjoying some nutrient veggies when the troublesome pea made its way down the wrong chute, entering the trachea instead of the esophagus. Once inside the lung, the pea then split and started to grow. As it turns out, the warmth and moistness of the human lung is ideal for rearing pea plants. A nail to the brain. A Chicago man, Dante Autullo, was building a shed when he accidentally misfired his trusty nail gun. Despite the errant nail striking Autullo in the head, he and his fiancée assumed it was just a graze. Thinking nothing of it, Autullo then got back to work. The following day, the DIY prodigy felt a little under the weather. Partner Gail Glasner convinced Autullo to go to the hospital. The doctors performed an X-ray that identified the source of their patient's woes. A 9-centimeter or 3.5-inch nail was embedded in his brain. Neurosurgeons spent 2 hours operating on the 34-year-old's head. They drilled 2 holes into his skull, eventually removing the nail and a piece of bone. A titanium mesh was then used to fill in the missing skull. The nail came within mere millimeters of a part of the brain that controls movement. Nonetheless, the self-proclaimed medical miracle appears to have suffered no lasting symptoms. Who is the hairiest of them all? An 18-year-old American woman presented with abdominal pain and distension. She would often vomit after eating food and had lost a staggering 18 kilograms. Upon physical examination, doctors identified a firm mass in the upper region of her abdomen. A CT scan confirmed a sizable mass, prompting gastrointestinal specialists to probe the region with an endoscope. The scope found a massive 5-kilogram or 10-pound clump of human hair. This is by no means the only case of extreme trichophagia. A young woman from Kyrgyzstan presented to doctors with a swollen abdomen. vomiting, malnourishment, and dehydration. After putting her under the knife, the surgical team unraveled a 4-kilogram trichobezoar. The woman had a history of munching away at her own hairy mane, along with bits of hair that she had scooped from the floor. Apparently, both women have kicked the habit. The human bomb. Afghanistan has long been a dangerous place. Private Channing Moss knows this fact more than most. Back in 2006, the 10th Mountain Division's Alpha Company went on a mission in Afghanistan's Paktika province. While U.S. troops were snaking their way through a series of dry riverbeds, a band of Taliban fighters opened fire on them. A number of guerrilla troops were firing RPGs when Moss was hurled against his own Humvee. Looking down, Moss discovered the tail fins of an RPG jutting from his abdomen. At great personal risk, the company's medic, Jared Angel, treated his companion's wounds. Angel then stabilized the RPG and tried to keep Moss calm. An explosive expert worked alongside a surgical team at a makeshift field hospital. The RPG's fins were removed first, and the rocket was gently extracted from Moss's chest. The explosives expert then detonated the ordnance while the surgeons finished their work. 4 surgeries and a lot of physical therapy later, Private Moss was able to collect his Purple Heart. 40 knives. An Indian man swallowed 40 knives over a period of several months. Perhaps slightly embarrassed by his unusual cravings, the 42-year-old failed to tell doctors that he had a habit of ingesting sharp instruments. Instead, the man simply told the team he was experiencing abdominal pain, letting the medical mystery go on for longer than it needed to. After conducting a series of diagnostic tests, doctors were alarmed to discover an arsenal of knives in his gut. An invasive procedure was the only means of retrieving the man's deadly stash. Days of preparation were necessary before surgery was given the go-ahead. It took surgeons 5 painstaking hours to remove the assortment of blades. Some of the knives were folded, others were left with the blade exposed, spanning lengths of up to 18 centimeters. Pica sufferers have been known to eat feces, soil, ice, paint, metal, glass, soap, toothbrushes, and clay. Over the years, a number of high-profile Pica cases have emerged. In 2002, a patient in France had over 4,000 francs in coins removed from his stomach. More recently, a British woman had to overcome her addiction to eating sponges. Glass bottle. A 73-year-old farmer was admitted to the University of Mississippi Medical Center with a bottle ensconced in his back passage. In the absence of a proper latrine, the man had ventured to a dumping ground to defecate in the great outdoors. Adhering to his customary ritual, the man devised a crude toilet by balancing a wooden board across 2 supports. He pulled down his pants and readied himself. Unfortunately, the gentleman had a slight issue with his weight, causing the board to break. The inquisitive reader may be skeptical about the man's tale. However, according to the scientific journal, it appears his story may hold water. The journal even goes on to chronicle some of the other bizarre objects removed from the anuses of patients. Aside from the regulars, cucumbers, carrots, broom handles, test tubes, etc., there were a few surprising ones. Among the more exotic objects have been spectacles, suitcase key, half-filled tobacco pouch, a box of tools weighing 634 grams, a stone, and a frozen pigtail. The pig's tail example was so curious that further inquiries were necessary. A quick literature search revealed that a bunch of students, for reasons unexplained, inserted the pig's tail into a prostitute's rectal cavity. When the tail thawed, its bristles made it difficult to extract. A stroke of genius provided the solution. A hollow reed was used to envelop the entire tail, and the whole thing was yanked out. Under pressure. Stephen McCormick will never forget the day he sparred with a high-pressure air hose. The New Zealand truck driver was standing between the cabin and the trailer of his truck when he lost his footing and slipped. In doing so, the unlucky trucker broke a high-pressure hose, which then pierced his left butt cheek. The trauma led to McCormick's lungs filling with fluid and the fat separating from his body's muscle. Doctors were surprised that McCormick's skin had endured the incident, especially considering air had been blasted into the man's body at 100 pounds per square inch. The air had filled his abdomen and thorax, applying dangerous pressure to his heart. Doctors drained the fluid from one of the man's lungs, removing the offending nozzle, and cleaned up his embarrassing wounds. After days of tremendous flatulence, McCormick returned to his normal, non-inflated size. Ectopic teeth. Obviously, it's not unusual to find teeth in the human body, but teeth growing in the wrong location can lead to some pretty unpleasant medical complications. While it is uncommon for people to develop more teeth than normal, ectopic teeth are even rarer. An entry into the American Journal of Neuroradiology describes several cases of ectopic teeth in the nasal cavity. In one instance, a 59-year-old patient presented with an obstructed left nostril. She had also complained of an unpleasant odor for 2 years. A series of CT scans showed an unusual structure embedded in her nasal cavity. Doctors delved around in the woman's face and extracted a tooth coated in a greasy substance. Histologic analysis confirmed the substance consisted of a fungus called Aspergillus, likely explaining the putrid smell. At just 9 years old, John Chris Carlquiante from the Philippines is a local curiosity. It all started when his parents realized he was growing more than the typical baby teeth. The boy's surgical team was forced to use a chisel and a hammer to extract over 230 tiny teeth. The marathon procedure took an exhausting 7 hours to complete. Gavai is now the proud owner of just 28 pearly whites. Surgical forceps. Surgeons all over the planet perform millions of operations each day. In 2009, approximately 48 million surgical inpatient operations took place in the U.S. alone, so it comes as little surprise when mistakes are made. A 36-year-old female underwent surgery to remove a hydatid cyst in the liver. Hydatid disease is typically contracted when humans accidentally ingest tapeworm eggs of the Echinococcus variety. Surgeons successfully removed the cyst, and the woman went back to living her life 18 years after the initial operation. Scans of the woman's abdomen revealed the remaining part of the surgical forceps. The instrument, now black and corroded, was extracted from the patient's colon. A similarly bungled operation occurred when a surgical team at Bach Khan Hospital in Vietnam left a pair of forceps inside a patient's abdomen. The man had endured years of aches and pains. These symptoms were alleviated when surgeons removed the 15-centimeter long forceps 18 years after the initial operation.